Hi, I'm Dr. Cash. This is Dr. Cash, Medical and Life, and welcome. So today we got a very frantic, dramatic call from the school nurse about our daughter. Okay, she's 11 years old. She's a fifth grader, and the nurse called and say, "You gotta come pick up your daughter right now." And so we're like, "Oh shoot, what happened?" So it turned out that, hey, your daughter has pink eye. Okay, and so my wife was like, but this morning she was fine. And the nurse was like, her eyes are all red. And so my wife had to rush to school. And as she entered the office, sure enough, our daughters was like sneezing, and her eyes was watery, and sure enough, they're pink. And she was just itchy eyes, sneezing, allergy type of symptoms. So my wife was like, she's having an allergy attack. And the nurse said, I don't care, take her away. She may spread to the rest of the class and the rest of the school. She made it sound that way. So anyways, our daughter came home, and we know exactly what it was. She had an allergy attack. We flushed it with water, and then put some eye drop on it, some allergy eye drop, and boom, 30 minutes later, everything's clear. She feels fine. Okay. So why do people get so afraid of pink eye? I mean, if you see someone with the red eyes, you're like, oh, I'm going to stay away, right? And so that we are kind of conditioned to think like that, just because pink eye can be pretty contagious, particularly the certain ones that are caused by viruses and bacteria. And therefore, people are conditioned to be quite concerned, afraid, and if anyone with pink eye, boom, stay away. Okay. So today I'll be talking about pink eye. And in order to understand that a little bit, let's go ahead and look at the structure of the eyes a little bit. Okay. And before we go into the disease process, let's take a look at the anatomy of the eye. The eye is one of the most important and vital organ of the human body. On the outside, you have the eyelids that will provide in general protection for the eye. Moving inward, you'll have a thin, clear coat surrounding the eyeball, which is called the conjunctiva, very highly vascularized with lots of blood vessels. And under that, you will have a thicker layer called the sclera, also covering the eyeball. And then in the center of the eye here, you can see that brown circular region, which is the iris, which opens and closes to allow light to go in. And then you have the pupils, which again is the opening towards the inside of the eye, which we'll have another discussion on another date. But that in general is the anatomy of the eye. Now that we have a little bit of understanding of the structure and anatomy of the eye, let's talk about some of the potential causes of pink eye. Okay, around this time of year, probably the most common cause is probably allergies, allergens of flying everywhere, pollens and flowers and everything else. And so a lot of kids will be walking with red eyes just because of allergies, attacks are horrible. Okay, but at the same time, in this case, in such as in our daughter's case, it was an allergy attack. But in other circumstances, it could be something like a virus. Probably the second most common cause of pink eye then is a viral infection. Okay. Again, it would be hard to distinguish between an allergic attack from a viral type of infection because the eye would be red and then you have discharge. Sometimes it could be a little bit cloudy, but most of the time it would be watery. So it will be hard to make that distinction. In terms of treatment-wise, there's not much you can do about it because it's caused by a virus. Supportive care, wash with water, and for comfort, you may give a little warm cloth, towel, and for symptomatic relief, but that's about it. Okay. Now, thirdly, you can have potentially a bacterial infection, which normally, in addition to the redness, you'll have thick, gooey purulent type of discharge, and your eyes will be kind of stuck together. So those are indication that likely it could be bacterial infection. And depending on the patient's age and population, you can have different kinds of bacteria involved. For example, a newborn can have a different kind of pink eye than a person who is in their mid 30s or something with certain risk factors and such. And so, depending on what age you are, you'll have different kind of infection, and then if you go and see the doctor will prescribe you different type of treatment depending on your symptoms and also depending on your age group. Okay, so allergies, virus, and bacteria. Other causes can be chemical irritants, can be fungus, can be other rare causes, but they're rare and they're less of a concern. Nonetheless, of course, if there's trauma to the eyes and it causes a person to have redness in their eyes, of course, it needs to be evaluated to just rule out making sure they don't have anything deeper that is causing damage to the eye that may need further treatments or observation. Okay. Now, there are certain warning signs that should concern parents or a patient enough to definitely seek medical attention. And some of these include if there's pain involved in the eyes, number one. Number two, if there's vision that is affected and blurry vision or seeing changes of colors, or if you have flashes of light or any of those things can be indications of other more dangerous conditions that should require an evaluation initially by a regular doc or in the ER, and then quite possibly evaluation by the specialist as well. Okay, so vision changes, pain in the eye, light flashings, things of that nature. Definitely go get evaluated. Well, today I hope that you learned something about pink eye, and there are certain things that you should be concerned and worry and isolate yourself. But at the same time, there are certain things that it will require just a little supportive care and self-isolation. It should be fine. It shouldn't be cause of any concern. Nonetheless, that being said, if there's any question at all, go seek help. And it's better safe than sorry. You only got one eye, one set of eyes. So if it goes kaput, that's it. So take good care of your eyes. Stay healthy. Stay happy. See you next time. Bye.